So we're going to err on the side of being cautious with our time. And so we're going to jump right into it here in the next minute. I'm going to first start off by introducing Fred. So Fred works with an organization called Sertainty. They represent the backbone to a lot of the solutions that we're going over today. So we thought it'd be best to start with Fred, talk a little bit about the backbone. Then we're going to pass it off to Leiron. His technology focuses on wearables, and then we're going to pass it off to Jody, who has more Internet of Things and sensor data. They can talk in depth as much as you like. So if you guys have technical questions about compliance or QA, auditing, anything in particular, ask those questions in the comment section of our webinar, and then we can answer them in the Q&A section at the end. So technical, not technical, business, other, go ahead and post your questions in the comment section as we go through the conversation, and then at the end, we'll be more than happy to answer those for you. All right, so looks like we have about 13 people, and more people are joining every minute, so it's probably a good time to get started. Again, my name is Daniel Klein. Thank you very much for joining us for our webinar today. We're really excited to have you, and we have some really cool things to talk about. I'm going to pass it off to Fred to kick us off, and in the meantime, I'm going to go ahead and start sharing some slides. Fred, the floor is yours. Thank you very much for joining us today.
Thank you, Daniel. Welcome everyone to this really important webinar. Sertainty is proud to bring 8 webinars during 2020 across all vertical industries. And today we have the pleasure to focus on healthcare. Healthcare is not unique to data. Data is the asset regardless of the vertical, whether it's the financial world, the healthcare world, technology, and so forth. We're pleased to have a group of speakers today that are coming out of stealth, have been working for years, and are releasing over the next month or two technologies that are revolutionary, that are primarily focused at the current pandemic, COVID-19, but are geared to poise, to monitor, test all kinds of various pollutants and irritants and pandemic type viruses going into the future. Sertainty is not with any exception. Our company came out of stealth in 2019 after years of development to create a technology that empowers data to not only be secure, but to have governance and the ability to log itself, which is totally a new technology. And the examples we're going to be looking at today are the exact same thing. We've got RAM Global with Dr. Jody Rank, who will be talking about an emerging technology that can test non-invasively COVID-19 within less than a minute, which is revolutionary, as well as in monitoring the environment both indoors and outdoors for COVID-19 and other particles. RAM Global is an international company that has been working in the oil and gas industry for years, implementing their technologies. And now with COVID-19, they pulled some technology out of the closet that they felt was very, very cool, and noticed that it could rapidly monitor COVID-19. And so Dr. Rank will be talking about that and the sensors that they've been developing and the platform. Leiron Walker, the CTO of Modern Radio, recently won the Sertainty Cyber Health Tech Challenge. It was a $10,000 prize in Atlanta, August 6th, where we had over 8 companies challenging embedding Sertainty's technology into healthcare solutions. Leiron is a veteran of technology. He loves IoT, went to Purdue. We got to keep the coffee away from him because he just gets going and it's super. So today he promised me he'd lay off the espresso. And he's got a company that not only monitors with tiny sensors wirelessly food supplies with restaurants, but in healthcare and supply chain. His partner, Champ Bailey, working together. Champ is NFL and college football star, but a great person who's been entrepreneurial. Him and Leiron got together and they've developed a smart mask with sensors and an application that can be utilized in large groups like sporting events, churches, schools, and so forth. So we're really excited. On behalf of Sertainty, we'd like to thank all of you for joining us today. And this will be recorded and you will be getting a link to the recording. So on that note, let's kick it in and go ahead and start the session. We will have Q&A at the end, so we're going to roll through and show you some slides that will allow us to go ahead and move forward with the presentation. 30 years ago, NASA was preparing to launch the space station, and one of the things they had to consider was if an astronaut or astronauts were injured, how would they be monitored and cared for until they could be shuttled back to Earth. I was living in Stockholm, Sweden, working with Siemens Medical and heading up a team that was working on this project. And that was the first time that I was indoctrinated to telemedicine. I mean, really telemedicine, thousands and thousands of miles away with sensors. We created computer-aided ventilation and gas analysis and made a closed loop system that the machine could monitor and adjust for that astronaut's health. We brought that technology to Earth, and nowadays people are sleeping with it every night, called a CPAP machine and monitors and so forth. And we felt really cool because we had surface mounted boards and EEPROMs with software on it. Go ahead, fast forward 20 years, Cleveland Clinic, I was CEO heading up a spinoff between NASA and Cleveland Clinic, monitoring those astronauts remotely with technologies that we then transferred to monitoring home care patients using blood thinners and so forth, with tiny chips the size of a hair. And now we fast forward to COVID-19, where now we have technologies that you can grab off the shelf and create testing capabilities and monitoring capabilities. And all through this 30+ year span, data has always been the asset. Data is probably more valuable than oil. And now, if you remember, what cell phone did you have in 1990? What computer did you have? Did you have a 1200 baud mode rate connection? And nowadays, your phone is something light years ahead of what we had behind. So this morning, we're going to explore some really incredible technologies that are coming out of stealth that have embedded Sertainty's technology to not only protect that data wherever it is, at rest, in transit, and at the end, and also have rules and be able to log itself, all things that HIPAA requirements provide. So let's take a dive into the drivers for this remote monitoring and testing. Obviously, it's been going on for years. A partner of mine, Friedel and Vogeli, Swiss, 2004, we received international and national patents on a wireless health web-based platform, but there was no reimbursement. There was really no way to pay for it. And this kind of occurred all the way up through a couple years ago when Medicare finally created codes that would help reimburse physicians and clinicians for remote monitoring. But what really created a projectile of using telehealth is COVID-19. COVID-19 brought out the thrust into testing, into telemedicine, and stocks like Teladoc, Amwell, and so forth have skyrocketed. So it's really amazing how COVID-19 has accelerated. I've been using this acronym for over 20 years. When you get up in the morning and you look in the mirror, you assess yourself, you communicate to your brain and you say, oh my gosh, I got to fix my hair. Then you get out a brush and you brush your hair. Then you look back in the mirror and go, okay, I'm ready to go to work. Same thing that clinicians and physicians use when assessing a patient remotely. They assess through devices or personal input. That data is then sent via Bluetooth or via the cloud to a platform where a clinician monitoring center reviews it and matches it with care plans. And then a treatment sent out to that patient where that cycle then continues of assessing, communicating, and treating. We call it ACT. Peter Atwell, MD, Chief Medical Officer at Amwell, said that telehealth is an ideal venue for initial screening of patients with respiratory conditions that are common with COVID-19, and we've seen that dramatically. You know, obviously, when I was working at the Cleveland Clinic, we had to integrate with Epic EMR. EMR's electronic medical records have made data the king. The biggest problem has been interfacing with these large EMRs. And a gentleman that I know, Andy Penn, the VP at Cerner, made this quote, which I felt was really interesting, focusing on data. At every instance, when the beginning or the birth of that data, all the way to the end where it has to be archived or destroyed, it's vulnerable to a potential breach. So what is self-protecting data? Why is it important? Why are banks and institutions and printing bureaus using data that's self-protecting, certainty data? I'm going to just tell you a little bit about it. Healthcare self-protecting data means that in addition to all the external security measures like VPNs and endpoint protections and encryption, the data itself is still vulnerable. It's almost like taking a baby outside. You have to have clothes on it. You have to make sure it's okay. You got to protect it. You got to get it to the babysitter. Data is no different. On its own is extremely vulnerable. So what Sertainty has developed is what's called the UXP technology that combines intelligence into the data itself. And it doesn't really matter what data it is. It could be an X-ray, it could be a music file, a video file, any type of data, it doesn't matter. The data could be viewed as like a Rubik's Cube. And the Rubik's Cube is made up of different components. So what the self-protecting technology, the UXP embedded file, takes the data file and embeds intelligence, audit logs. There are no keys required. And this technology has been tested by multiple third parties in a penetration test scoring 100, which is the maximum score that can be done. And again, this type of technology is not specific to any industry. I've been in the healthcare field since the early 80s, and I've run large remote monitoring companies with over 350,000 patients. And the data has to be protected wherever it begins. So in this example, a person's using a small ECG device with their hands, transmitting that data. That's when the data starts. Transmits Bluetooth to a cell phone, via the cloud up to an Azure cloud, down to a monitoring center where a clinical report's made. The clinicians review it, they determine a care plan, and the patient's taken care of. All those steps are incorporating and require security. Daniel, I'd like to turn it over now for you to begin our first presenter from Modern Radio.
Thanks, Fred. Great introduction. So that covers the backbone of the technology that we're talking about here today. The first kind of implementation of that technology we want to showcase and feel free to ask questions on is via Modern Radio. And Leiron and his team have done an amazing job. They just won a prize for this technology. So congratulations to you guys. But I'll not steal any more thunder from Leiron. Sir, the floor is yours. I'm really excited to hear about your technology and what you guys have done.
Perfect. Well, good morning, everybody. Again, I'm Leiron Walker, and I'm the CTO of a company called Modern Radio. And at Modern Radio, we build plug-and-play technology that leverage the Internet of Things. And for those of you who are not familiar with that particular terminology, essentially we build sensors and devices, and we also combine that with software and applications to allow for you to be able to make operation decisions that allow for you to best serve your customers or your organization. In working with the Internet of Things, there are a number of scenarios that really matter. If we can get to the next slide. You have to be able to get real-time data, use that data to inform decisions, and ultimately take those decisions to operate and create results. And again, that's what we're building end-to-end solutions around that. Our team builds the hardware, we build the software, and the requisite tools to make that happen. We apply these tools across a number of industries that really a lot of people find important. So think of industrial controls. You're a company who's manufacturing a widget, and that widget has to go through the supply chain to service your customers. And while that's happening in historical times, there was not a lot of data that allows you to make decisions. And so in the modern video world, we can instrument that device. So one of our customers today, as an example, is a supply chain company, and they manufacture corrugated products. As they wanted to increase efficiency, they increased the RPMs of that particular machine as it's producing these boxes. But as you increase the speed of that production process, you create errors. So being able to instrument that system, being able to collect data, determining if there's a quality factor by way of a digital camera or some kind of a sensor that's measuring if the box when it's produced has too much stress on it. Again, IoT allows that to happen. In the smart building scenario, let's talk about that. We produce a lot of sensors that deal with environmental monitoring and air quality. So think about scenarios where one of our customers is they manage buildings, and they're building new schools. And their scenario, they're building schools, construction zones next to existing schools where kids are attending every day. So in that use case, we're deploying air quality sensors that are looking for particulates in the air because parents have a concern about dust and particles and if that's going to affect their asthmatic kid. So how do you deploy a sensor network that allows it to happen to get those insights? We also do a lot of work in the retail cold chain use case. And this is one of the use cases that Fred and I also talk a lot about. And this is where you have companies that are producing goods that are stored in warehouses, that are stored in shelves. So if you're a manufacturer of a temperamental good that has to be produced at a point of production, let's say a farm, and you're shipping it throughout your supply chain, and there's a vendor who is putting this particular asset in the back of a truck that has a refrigerator or reefer unit, and it's delivered ultimately to a restaurant to produce that. How are you able to take sensors, devices, and connectivity to track that from the point of production to the point of destination and ensure along that entire journey that everything is properly mandated and that the vendors that are a part of your ecosystem or people that are not a part of your ecosystem that you control are fully in compliance? That's the promise of IoT. Again, we can build these plug and run ecosystems that allow for everybody to have operational insights into what's happening and ultimately make decisions that keep things moving safely and on time. So given that, we were doing a lot of interesting things in the pre-COVID-19 world. We were launching national pilots with partners and restaurants. We had a lot of pilots lined up. Then one day, all our flights got canceled. I had 3 flights planned the first week when COVID really hit very hard. And that caused our team to sit back and think about things that we could do to really reassess and readjust how we're operating. And one of the things that prompted that forward, and as well later you'll hear from Champ, is that we have young kids that are out there, and this problem really hasn't had a great solution. I found this chart, which unfortunately is a few weeks old, and so the numbers are a little bit worse now. But if you look at this top number, it's purported that on current trends that we're probably in the U.S. alone going to lose as many people to this COVID pandemic as we have to World War II. And that's a staggering number. Every month, we're almost losing as many people as we lost in 9/11, to put that in perspective. So these numbers are staggering, and there really has to be something that can come together to allow us to take all this technology that we have, all this sensing and measuring and compliance abilities, to apply it to really to address this use case. And so given that backdrop, we actually have developed a technology called the Smart Mask. And very simply put, all this technology we've been working with in the retail supply chain scenarios, cold chain, smart buildings, we've applied it to a mask, and we'll allow for you to really take this technology to try to address this COVID pandemic. So what are we doing here? I think we can all agree that wearing a mask is one of the safest things that needs to happen to try to prevent the transmission of COVID. But on the flip side of that, we also realize that if you're going into any place today, you want to know if somebody has a temperature that's spiking, and if somebody happens to have COVID and has broken the barrier that we set, i.e. 6 feet, and something happens later, you would like to be able to immediately perform some kind of a contact tracing. Unfortunately, the current state of the art, a lot of these bits and pieces are not really connected, and they rely a lot on humans to be a part of that loop. And we're looking to really change that case. So in our scenario, we have taken and built an aftermarket sensor that can affix to any mask that exists in the market, in addition to masks that we produce. And with this scenario, we're able to address this problem. And on the next slide, let me paint a scenario for you. So look at the picture below, and you see there's a receptionist, and she's in this particular place of business, and she has her mask on. I want you to imagine a scenario where everybody in this office is wearing a mask, and all this data is being transmitted wirelessly. And so without a human being in the loop, this data is in the air, and it's ready to be surfaced to make decisions. Now, what is this mask measuring? It's measuring if the mask is on or off. It's determining if a person is coughing or sneezing. It has the ability to not just measure a point in time facial measurement. It actually has a constant real-time facial measurement, which I'll dig into a little bit later. And more importantly, if you're a service organization, i.e. a restaurant, or you're a meat packing plant where you're making things that people are close together and you have a mandate that people must wear masks, this particular solution allows for us to be able to alert on those things all in real time. And that's a really big differentiator. We're collecting multiple points of measurement that allow for you to make a decision as if somebody has an issue and if you're meeting the SOPs that have been set by your organization. More importantly, compliance monitoring is the case. And so pre-COVID, our use case wasn't really focused on compliance monitoring and cost detection. Frankly, we were building this mask for scenarios around the hazardous chemicals. Most of you are probably familiar with the story that was in the news a few months back with a restaurant chain, I won't mention their name, where a customer or a janitor there was mixing chemicals together. And unfortunately, they put together a toxic mix of chemicals that they didn't realize was happening. And due to ingesting that particular chemical, that particular person unfortunately passed away. And so we started this technology thinking about use cases like that. And then we often think about some of the frontline workers who work at auto body shops where they're spraying chemicals to paint cars and things along those lines, where they are not able to detect these fumes, or people who are exposed to things like ethanol. And so we started with that as being a backdrop, and then we moved forward with this technology to be able to address the solution. Now, in doing that, we've got a lot of interest from a lot of partners around this technology. But one thing that we found was that you can't always come in and just bring your own network. There's a lot of existing infrastructure that's already in place. And so in our solution, we've also present a plug-and-play router. And what's nice about this particular device is that it's a simple USB extendable, we call it plug-and-play IoT stick. It can affix to any router, any gateway, any existing network, and then Modern Radio delivers a software development kit that delivers this data to you in real time. And so think of us as being the last mile between the sensor and the solution, and then this gets you data back over to your system of record. And so we're really excited by that. As it stands today, we're doing a number of different pilots and scenarios. Our initial and most prominent use case we're focusing on today is around getting our kids safely back in school. We often say the NBA has their bubble, and I'm enjoying that because I'm a basketball fan. The NFL has their bubble, and they're figuring things out. MLB is figuring their things out because they have the resources, the time, and the effort. We thought weeks ago that students were not as susceptible to COVID-19. That's proven not to be the case. There are a number of schools and colleges that are closing due to kids getting sick. And so our initial and most prominent use case is about getting our schools to be able to create their own bubbles using our technology and our masks to help them with compliance. And this is an example of our mobile app where you can see in this case Joshua Smith. He's a 7th grade kid. He is in school and he's not wearing his mask, and his mother or father is at home with our mobile app getting real-time feedback as to, hey, Joshua, put your mask on. We also are we have a pilot kicking off with a school in Arkansas where they have 400 kids that are in their schools, and we're building the back-end mobile app that'll deal with the compliance testing. So the questionnaire, hey, have you been exposed to somebody with COVID-19? Do you have any issues? So we're building that particular app so when kids get on the school bus in the morning, they'll fill these questionnaires out. When they get to school at the end of the day, they'll be able to check and see if their student actually answered the questionnaire. And then using our plug-and-play route and our mask product, we're able to correlate the data back in the cloud and kind of pull it all together. So we're very, very excited by that. So therein lies our issue. So let's talk about Sertainty. Greg gave some amazing presentations and use cases around how the Sertainty technology is really important and the reasons behind doing that. So I just gave examples of we're taking a lot of confidential data over the air. You may be determining from this data set if somebody's sick or has COVID-19 or has been exposed to it. You're determining who should be quarantined, and you're making some very, very important operational decisions that could really impact your business, cost you time, money, or impact somebody's life. And so in doing that, we rely on the open internet to transmit this data. And that's why we're excited about a partnership with Sertainty. By leveraging the Sertainty technology, since we control data that's created at the point of the device, we can encrypt data from our device to our gateway. We control that 100%, no ifs, ands, or buts around that. But as soon as we hand that data off from our gateway to this open internet, we don't have any control until it's received on our cloud. So Sertainty allows for us to embed this technology within our application, our routers, and our cloud solutions, allows for us to prevent spoofing the data. It allows for us to eliminate man-in-the-middle attacks. It also allows for us to have our partners make decisions with confidence because they realize that our data is exactly what it says it is, and that they're not making a decision, without the right information. More importantly, as we dig into some of our medical scenarios, we talk to some of our partners and integrators who work in medical and more highly regulated environments. They're extremely excited about the fact that we can protect this data and not expose patient information and expose concerns around complaints and constraints that are set by HIPAA. And so that's what we're doing. We're very excited by that. I'm excited to talk more in the Q&A. And I'll just let you know, in terms of where we are with this product, we have done extensive testing. Our pilots are kicking off now. And we actually, we're launching a crowdfunding campaign to try to get as many of these masks created as possible next month. Because our desire, as I said, frankly put, is that we want to go and produce millions of these masks to make sure our kids and our schools can create their own bubbles, and our kids can go to school so we can actually get on phone calls and not worry about who's in the background. So with that, I'll pause and throw it back to Daniel.
Awesome. Cool. Yeah, that's great. I gotta say, kids can't get away with anything these days, can they? All right. So next up, we have Dr. Jody Rank. Dr. Rank has some sensor data and sensor technology that I think absolutely phenomenal. So without further ado, Dr. Rank, I'll turn it over to you. I'll go ahead and give you control of the slides here as well.
Okay. So good morning or good afternoon, depending on where you are. So I'm with RAM Group. I'm our EVP of Global Health Strategy. And RAM Group, we're a next generation sensor company. I'm not seeing the, oh, here we go. Next generation sensor company that was formed by Ayal Ram, our founder CEO, who after working earlier in his life on a number of startups, had an exit, series of exits, but then found himself with a cancer diagnosis with only a 5% probability of survival. So after he survived this cancer that should have been detected a year earlier and not putting him in the situation he was with that 5% probability of survival, he invested in RAM Group to try to find, basically create the world's best sensors and diagnostic systems so others wouldn't have to go through the experience he had. So over the course of the last decade, we've been developing our platform and have a wide range of potential sensor applications. And the core of our innovation in general is we will use gallium nitride rather than silicon, but that is not every single sensor application. Some of the ones I talk about today are not gallium nitride, but we are a combination of sort of, chemical engineering, nanotech, and what we're trying to do is create these multi-parametric sensors that normally would require multiple sensors. We can capture the same data with one sensor. And what this multi-parametric data also does is we move you further up the causal ladder to understanding what's really going on there. And these sensors are also far less expensive. Oops, I lost our screen here. They're less expensive, and we have 1,000 times better signal to noise ratio. So in terms of healthcare, it's 1,000 times better signal to noise ratio than silicon. So what we have in the health arena right now we're developing is we have three main sensors. One is our QCRM, which is essentially a single point monitor that merely needs to touch a single point on the body. And we can generate the data that would normally require hospital-based equipment, hemodynamics monitoring that would cost up to several $100,000, and a heart catheterization, an invasive procedure. We can capture the same quality and quantity or range of variables that is far more invasive and expensive to capture by just touching a single point on the body. And I'll dig into that a little bit more. We have our Thea diagnostic platform, which is for direct detection of the SARS-CoV-2 virus, and our QAirSense platform, which is our air sensor initially rolling out in smart city deployments, but we've taken what would be a sort of industrial level air sensor that is much larger, and we've brought it down to a size that's far more deployable and scalable across cities, for example, and we'll get into that more. But all of these our sensors are connected to the cloud, and which opens up the possibilities for integrating various data streams and understanding, sort of what's going on in the body, where the body is in that environment, and understand, for example, in real time, if we think about California right now with wildfires, for example, to see how air pollution from the smoke in real time is impacting cardiopulmonary response. It opens up sort of the research opportunities to understand that better. Or for COVID, some of the initial reports from early on in the epidemic were seeing that communities that are exposed to higher levels of air pollution also are at greater risk of COVID-19 infections. So our first sort of platform to talk about is our QCRM, which is our quantum cardiorespiratory monitor. So as I mentioned, from a single point of contact, we're able to capture heart rate, breath rate, heart rate variability, blood pressure, and continuous blood pressure. And if we are in an earbud, we can even get your core temperature, and then the right atrium pressure dynamics, central venous pressure dynamics. These latter two are vitals that normally require a surgical procedure to capture that data. And so with our sensor, we can put it in a variety of form factors, from putting it on your wrist and smart glasses and a hearing aid, or in smart earbuds that you use for fitness and exercise, children's clothing to monitor toddlers, for example. And we're also developing a smart stethoscope with this technology as well. And and so just to reiterate, in contrast to a lot of the existing sensors on the market that drain the battery, we're ultra low power to zero power. And then one of the more interesting aspects too is it's come to light over the last year that the green LED used in a lot of the pulse oximeters and fitness devices on the market, there's a bit of a racial bias in there, in that if your skin is dark, there's a lot more, they're not nearly as accurate. And with our platform, we're not using an optical sensor like that. So if we think about, let's say monitoring people with long COVID, so forth, and the racial disparities with COVID, this is going to be an important thing for like remote patient monitoring as we go down the line, and just, even for your casual user in fitness. So it's a important innovation across multiple fronts. And in this slide, we're just showing how the implementation, where we can have the sensor in some sort of device that is in contact with the body, and then can integrate that via Bluetooth to a smart home assistant, your smartphone, and then into the cloud, and how in partnerships with folks like Sertainty and so forth, we can then ensure the privacy and security of that data, which in healthcare is paramount, as I'm sure you all know. And our air sensor is called QAirSense. And so you can see on the left hand, the sort of most sophisticated air sensor in the market that they use for research on air pollution and air quality and so forth. It's pretty much the size of a Amazon delivery van. And we're able to detect at the same levels as the most sophisticated sensor in the market without algorithmic enhancement that a lot of the air sensors that you see on the market, they're smaller, used in smart cities. We're able to do that with a sensor in a box about the size of like a very large shoe box, if you, for example, with boots or something along that size. And we can integrate that in an IoT smart city type of deployment. And at the cost point for this makes it far more feasible to deploy these across a city at scale and get more granular data, because we know, like, there are studies showing in the course of one city block, let's say if you're on this end of a block where there's heavy truck traffic, your exposure to air pollutants can be 7 times greater just in the course of one city block. So getting more granular data, direct detection, is going to give us a far better idea of the impact of air quality, and then policies we can do at the granular level to confront that challenge. And then we're also able to detect at single parts per billion, which in the EU is at the level that the regulators need, but a lot of the air sensors you see out there in the marketplace, they're unable to go below 10 parts per billion as we're able to do. And the maintenance of this is much easier because of the low drainage on the battery as well. And so here you can see sort of what we can detect. We can detect NOx, ozone, temperature, relative humidity, particulate matter 2.5 and 10, especially PM 2.5, and we're finding, science is showing that even below that, that can have the most detrimental impact on human health, even linked to things like Alzheimer's or dementia and Alzheimer's. Even in some studies are showing an impact even in children that age. So this is in compliance with a lot of the EU regulations, increasing what we'll see with like the EPA as well. And once again, here we show how that you basically can mount this on a pole that a telco, for example, that's running a smart city platform can integrate via Wi-Fi, LoRa, 4G, MQTT into the cloud infrastructure, have the data encrypted, and then we can then export that out to let's say a smartphone app where people can, will be able to see sort of at their street level eventually as we take this to scale, what are the air pollutants at a more granular level in the area or along their commute. And this puts the data in people's hands that they could change their running route, for example, or, do things and act on that data to change their behaviors or change their exposures through their behavior. And then the final platform I'll talk about is the one we're most excited about at the moment, given the pandemic. And this is our quantum digital sensing application for COVID called THEA. And it utilizes a terahertz sensor. And this was developed to be a point of care solution. And the first thing to recognize about this is that the platform is really novel in the realm of diagnostics, in that the existing diagnostics for detecting viruses or bacteria, even, just pathogen detection in general, they're based on biology, meaning they utilize RT-PCR, which is reverse transcriptase polymerase chain reaction, which requires biological reagents. And as you've seen in the news, that we've had lots of problems with supply chains and having enough of these reagents to scale up the test for the entire country and do them at the frequency we'd like. This is the first platform that's based on semiconductors and quantum physics, essentially, and we do not require reagents and labels, so that the supply chain is far simpler. And it's also direct detection of the virus. We can do it at lower cost, and we don't have to trade off on accuracy. We're just as accurate as the best PCR machines deployed at the point of care. And so there's been a lot of talk in the news about, well, we may need to do sacrifice accuracy for rapid, less expensive tests. And I think with our platform, we can change that equation where we don't have to sacrifice accuracy. And this can be connected to the cloud. And then most importantly, one of the most important features to understand is from the time of swabbing the throat, where you don't have to have your brain picked with a swab with this machine, and then swabbing our cartridge, which you can see in step 2, inserting that into the machine and getting the readout, it's in approximately 1 minute. So in fact, once that cartridge enters the machine, we can generate the results in 15 seconds. So this will make our platform ideal for, and one of the reasons we jumped on this opportunity is we feel like rapid, accurate testing is going to be the key to opening up the economy and having some sort of return to normalcy, where we can go back to schools and universities, travel through airports, watch our NFL games and any other sports, and get back into the workplace when we have scalable, efficient, affordable diagnostics. And that's where we are going with this. And we hope to have this out ready to go with the regulatory bodies within weeks. And then on the tail of this, in the fairly near future, even have a breathalyzer that's even faster and even more deployable and handheld. That's in our queue before too long. So on that note, I'll turn it back to Daniel.
Thank you, Dr. Rank. Okay, so really cool technologies that we've covered here today. And before we get to the Q&A, we have a special guest, Chant Bailey, who's an investor with Modern Radio and NFL Pro. Champ, I kind of like to get your thoughts a little bit on why this is important to you and the direction that you'd like for this to go.
Well, simply put, these are real solutions. And going back to what Layron, referenced earlier about our young kids, we all have that concern of them going back to school and being in these groups. So, our heightened awareness of that problem, requires us to dig deeper for better solutions. And that's kind of where we became one. And, we kind of worked together on this. For instance, then as I get that solution in my head around, my kids, of course, I want to reach out to his school and make sure they get this in place. And of course, that's in process. But at the same time, I think back to the people that I used to work for and the people I used to work with. And fortunate enough for me, I happen to be on the NFL's competition committee this year. So I'm privy to all the information, all the protocols that are in place, and the things that they're asking each club to do in order to keep the players safe and staff safe. So with that knowledge, I understood they're taking a bunch of disconnected use case data and trying to come up with solutions. And I just felt like the mass could comprehensively accomplish all the things that they want to accomplish. And with that being said, I think back to that last slide that we just saw, and you see all these people gathering. And from a sports fan perspective, and obviously a former athlete, we want to make sure that we can fill up a stadium like we see now on this screen. We want to make sure our kids can go back to school where people can gather, concerts, school, university. There's so many different areas of life that we would love to get back to where people can gather. And these solutions, I mean, they're the best I've seen. I mean, I thought the mass was great. Now I'm looking at this, 1 minute test. I mean, oh my God. I mean, I feel like this platform absolutely gives us the opportunity to provide solutions across the board in any industry. And that's why I'm involved.
That's awesome. Thank you. So we are at the end of the presentation, which means that we are at the beginning of the Q&A. Before we hop to the Q&A, go ahead and take a screenshot of this if you like. We'll send a follow-up email with everyone's contact information. There's going to be a recorded version of our webinar here as well. And also everyone in the meeting today is also on LinkedIn. So if you have follow-up questions outside, this is good contact information to get your questions answered. If you want to have a meeting with anybody, LinkedIn is also a great way to get in touch with these folks. Now, so Q&A, I'm really excited to hear your questions. It looks like we have a couple here. I'm going to go ahead and stop the screen share. Fred, if you could give me a hand with some of these questions, I'm excited to see what we got here.
Sure, Daniel. Thanks, gentlemen, for the great presentations. And we do have a Q&A section. So if any of you out there want to ask any of the panelists a question, it'll pop up. We've got it in front of us. Layron, you were asked a couple questions during your presentation. I don't know if you can see the question. You did answer them. Would you like to walk through those questions that are on the Q&A screen?
Sure, I would definitely do that. So one question came in and asked, what specific guidelines do we fulfill the protection of data as it relates to HIPAA? And one point I want to make there is that one of the most important requirements of HIPAA is not exposing, patient information and information about who that patient is. And so one of our unique capabilities is that we manufacture and build a device, which means we control the firmware, the communication protocol, and how it's transmitted. And so we control that piece. We also then control the router or the gateway that receives that data. And we also then control how the framework from which that device sends data back over the cloud. And so we have control over the entire ecosystem with our core technology and with data certainty. And so when we deploy these particular solutions, typically what will happen is that patient or organization has an ERP or some EMR that they're leveraging. Our individual devices have unique identifiers. And so we as an organization never know who actually has that mask or what they're doing with it. So that also helps as well, is that it's anonymized, but using our back-end technology, our algorithms and machine learning, we can make decisions around that to help you inform decisions. And so that entire ecosystem, having control from end to end, allows you to be in compliance with things such as HIPAA. Another question that came in was around what particular technologies are we leveraging for the data transmission piece of the conversation. I intentionally kept things at a high level, but do know that we support both things. We support transition protocols. We typically have multi-function radios. So we have Bluetooth low energy variants of our technology, and we also then have sub 1 gigahertz type technologies as well. So think of things like Sigfox LoRa, Amazon calls it Sidewalk, for those 900 megahertz frequencies type scenarios. And our dongle that we provide that I showed, we have both a Bluetooth and a sub 1G variant of that as well. I think those, and then the last question I saw was, are these scenarios in support of things such as remote patient monitoring? The answer is yes. We focus specifically on this use case today because of the nature of the conversation, but we do have utility patterns that are issued and technology that support a myriad of use cases for remote patient monitoring. We have scenarios around detecting if you're an agent in place or an assisted living facility and you try to make sure that that person you care about is properly maintained. We have a slew of sensors for things like fall detection, or moved out of your bed, things like that. So a lot of scenarios. The last point I'll say there is that we often say that we, through our research and expertise over the years, we typically have solved about 85% of the use case that needs to be presented, and that last 15% is typically form and function. So.
One of the questions that came in for modern radio are, what are the top verticals you're gaining most traction in? Maybe you could break that down into pre-COVID and post-COVID.
Yeah, so pre-COVID, we have spent a lot of time and had a lot of expertise in cold chain logistics. Is a really big popular field for us. So think of, again, restaurants, warehouse facilities, cold storage facilities. So we spend a lot of time there, and then naturally that dovetails directly into logistics and transportation. So cold chain logistics and transportation have been our primary focuses pre-COVID. And since now we found ways to pivot to address this current concern within the smart mask and monitoring solution that we have now, we're finding ourselves very heavy looking at the education vertical, municipalities, government building type organizations, and that's clearly moving also into retail and sports as well. So those are the places where we're spending our time at in it today, but across the board, those are things that we spend our time on and are excited about.
Got a question from the Big D, David McCampbell out there in Georgia. First, to my favorite former Bulldog, go Dogs. Says, second, thank you, Fred,
Yes,
Leiron, and Dr. Rank for your outstanding leadership and the innovation you're providing. We'll all need you now more than ever. Lastly, how soon will you see these smart devices in use?
Yeah.
Who wants to go first?
Go ahead.
Oh,
okay.
Okay, sure. So our Thea Diagnostic, we're completing the clinical studies literally this week and next in Brazil and in several sites in Germany. And then we'll be registering for our CE, or self-registration for the CE mark in Europe. And then we'll be following up very shortly after that with FDA. So literally within weeks, we can start using this in the marketplace, and we have to scale up manufacture with the QCRM platform for remote patient monitoring and kind of smart devices for vital signs. We now have the prototypes ready to go, and we're in active discussions with some of the wearables manufacturers about integrating our sensor into those devices. So when it fits into their product lines, but I think now with the sort of long COVID patients we're seeing and the rise of virtual care, telehealth, so forth, that's going to open up the door to a lot of other remote patient monitoring partnerships we can do as well. But we're ready to go, finishing clinical studies.
And from the modern radio side, we're, just to make sure I'm clear and properly set expectations here, we're not coming from a critical diagnosis perspective. We're coming from a compliance perspective and giving you more data to make decisions. And so we're not as so concerned about things like FDA clearance, because we're just giving you tools that you can imagine. So our initial use case is focusing simply on compliance. Is your mask on? Is your mask off? And giving this extra information. But here's an example, like the mask is here with me now. So we have functional, small, low-rate productions that we're doing now in our office in Orlando. And we're using those in our pilots at schools, and we're scaling that up. And that's the reason I mentioned earlier that we're going to put together a crowdfunding campaign, surely for the same reasons that we just mentioned. We are trying to get to a big production scale run to push that out. I'll actually let Champ come back in and speak about some of the larger scenarios that we're working on that we're looking at that may lead to much larger implementations. So Champ, come in and kind of explain some of those things.
Well, I sort of alluded to it earlier. You know, my son's school, you mentioned the school districts in Arkansas, the school we're trying to do things with. But, you know, I think more impactful is college football, you know, reaching out to the University of Georgia and understanding that they don't really have the solutions the NFL has. And the things we understand is, you know, even though these are some of the smartest people in the business, they don't really know how to deal with COVID. And, you know, that's obviously I care deeply about them, but at the same time, how do we get them protected and comfortable in that environment? And obviously, how do we protect these young men in their future? So, you know, those are some large scale things, you know, that we're doing. We had a call this morning with the head of NFL safety and health. And I mean, he's blown away by what he's seeing and what he's hearing from us. Now it's just, you know, how do we attach ourselves to the platform that they've already created? You know, and I think, you know, judging the solutions that we have, we feel that there's a really good connection that's bound to happen just because they don't have these solutions at all. And those questions just keep coming up. Every day I get a response, you know, about this mask. When can I get it? When can I get it? So, you know, I'm just ready to go ahead and, you know, go with the production and take care of some of these problems from some of the people I know.
One of the great advantages of doing my job in business development is really identifying and meeting companies and individuals like we have today. And August 6th, we had a cyber health tech event in Atlanta that Sertainty helped sponsor a challenge. And we had over 8 challengers, and now they're all working together and talking about how they can help each other with the premise of keeping that data not only safe and secure, but giving it rules so that it doesn't end up in China or a wrong time zone or in the hands of someone who wants to sell it on the dark web. One of the questions that came up prior to the event from one of the attendees that may or may not have been able to make it, Sue Gullen out of Mineral Point, Wisconsin, works in a school district, and she read the information about the webinar and said, we would love to be a pilot. We would love to be a guinea pig. What do people do that are viewing this that would love to explore being a test site in a school district or a church or concerts or the music industry or theaters? Tell us a little bit about your plans to open up to take in the initial people that want to try your technologies.
Got it. So from the modern radio side, as we mentioned, we're actively looking for a few more pilot partners. So you can go to modernradio.io or email me directly at walkerla@mdrdio.com. What we're doing now, we're doing some very interesting, like I said, closed pilots that'll happen over the next month or so. But frankly, we've been working on this for the better part of 4 or 5 months. And so our initial focus moving past that is getting to scale, as Shep mentioned. We do have a lot of dialogue that's happening with people who really want to get our hands on this technology. So most importantly for us is understanding if people want to use the technology, having a sense of how they would expect to use it, working on integrations with their platforms, and just making sure that as we run and scale our production, that we can have enough in place, because we know that even though vaccines are in talks and things may happen, this will move well into the spring. And so our desire is that as the kids come back online in January in these classrooms, we want to make sure that as many people as possible have this technology and able to use it. So anybody who's in that space, please reach out. We respond 24/7 and love to earn your partnership.
And on the RAM Group side, most of our initial conversations have been at the country or sort of state level, large cities, things like that. And I think once we can get some of those under our belt and scale up production, and then also hopefully accelerate even our breathalyzer development, which would be even more important for these large venues, you know, points of ingress, egress, and all of that, then we can, you know, meet the supply demands of the smaller venues. But, you know, large professional leagues, large employers, countries, states. That's the level that will initially roll out, so we can get our manufacturing in line to meet the scale that we need to kind of drill down into your kid's school and so forth eventually.
Well, thank you. One of the big aspects, and Leiron and I have been talking about this for almost a year now, is the food industry. We were discussing with a cheese packaging company in Monroe, Wisconsin. They have over 350 employees, and they've been having trouble with testing. Everyone's okay at the plant, but on the weekends, it's giddy up time and go see everyone. And so this technology is really, the food industry, meat packing, cheese, other areas, a huge, huge opportunity.
Yeah.
We're getting down on a couple minutes left on data security. We've had several clients come to us and say that, well, data from Bluetooth, it's a de-identified data, and once it gets to the cloud, whether it's Azure or AWS, whatever, they feel it's safe enough. Can either of you discuss your thoughts and after talking with us and working with us, that no matter where the data is, whether it's in the cloud, it may not be as safe as what people think.
And I can address that, yeah. So ultimately, as I kind of alluded to in my presentation, you could control data that maybe comes from router to gateway, but also even like your cell phone, this data is in the open internet. It's a radio wave, right? And so there's always a way to spoof and or try to fake that data happening. And so if there's a wireless transmission, that's an attack vector. And so being able to employ some of the technology that we pull from our previous experience, but then also knowing that that data happens to be spoofed, that on the other side that we can't break it apart without having access to technology such as the UXP framework, that's really important, because nothing that's being transmitted wirelessly is completely secure. I think that's something that people need to realize. Walking around with your cell phone, there is somebody who can have a device in the middle that can hear your phone conversation. That's just the way the world works. So wireless is always an open issue.
And I think in healthcare, we're seeing the effects of that, where numerous hospitals in recent years have been taken over with ransomware and have even had to relocate patients to other hospitals when they couldn't access patient records. And just recently we saw, even with Garmin getting hacked, 3 weeks ago, and paying a ransomware bounty to be able to sync your data from your Garmin device with their, I think, there are lots of flaws in some of the existing services. So this is definitely one of the reasons why we're thinking very early about, sort of partnering with Sertainty and so forth, and making sure our data is far more secure.
Daniel, we have one last question. I know we're down to about 2 minutes. Can we go ahead with that one last question? All right, thank you, sir. This is from Amir Sternhal. Dr. Rank, has RAM Global been part of an OT-IT convergence initiative?
Not to my knowledge, but we do, prior to the pandemic, we were in multiple discussions with some supply chain related and oil and gas sector related sensor, use cases with our sensor, where I believe that kind of thing would be possible in the future, but they've been somewhat delayed due to the pandemic and some of our needs in getting this COVID diagnostic out. But definitely in the future, we hope that could be part of it.
One last comment, and I'll turn it back to Daniel. First of all, thank you, gentlemen, and all involved and all the attendees. I've been developing technologies and been in healthcare since a teenager, and even though I'm past that halftime in age, I've never been so excited about technologies, and we've got a good 40, 50 more years, because you guys and your technology will all live to be over 100 and very healthy and happy. So thank you so much. And Daniel, I'll turn it back to you. Guys, I really appreciate it. A lot of great effort in this, and thank you again.
Awesome. Thanks, Fred.
Thanks,
Thanks,
Fred.
everyone. So in the next day or so, we're going to have the replay uploaded to YouTube, and feel free to connect with us on social media. LinkedIn is a great place to connect with all of our brands that were listed out here today. Last but not least, thank you very much for your time. We do this like every 2 or 3 weeks. So stay close to Eventbrite, because in a couple days, we're going to announce the next webinar coming out, and we look forward to seeing you there. Have a great rest of your day. If you need anything, feel free to reach out. Bye for now, guys.
Everyone be safe.
Thanks,
Bye.
Adam.
Thanks.